Good morning and welcome back to JP, Kathy, and the crew on 1160 AM, KBDT News Talk Sports. Learn about the amazing world of real estate investing. Don't miss Lifestyles Unlimited, the Del Walmsley Show this morning at 11 o'clock, only on 1160 AM, KBDT. Headed towards a high of 57 today, a low of 41. Currently, we are at 46 degrees here in the DFW area, and we're really excited. We've got calling in, instead of usually if you're used to seeing them on Facebook Live, as soon as all of these limitations, all of these physical distancing, because I know you're not supposed to say social distancing now. I can't keep it all straight, but soon we'll have Patty Gialot of Something for Kelly and Steve Dunn back in studio. Very fortunate to have them calling in today, and we've got a fantastic guest they're going to be introducing for our mental health moment, our Acadia mental health moment. So good morning, Steve, and good morning, Patty. How are y'all?
Good morning, Kathy. We are so happy to be here today. Even though it's virtual, it's always good to see you and to talk on Tuesday.
We will take that. And I tell you, we've got a very important guest today. So, Patty and Steve, I'm going to let y'all introduce the good doctor, and let's talk about this important topic that we have going on today.
Thank you, Kathy. Good morning, Dr. Hansen. This is Patty.
Good morning.
Welcome
How
to
are
our
you?
show. We are great today. We are very excited to have you on the show. Let's just start right away with who you are and a little bit about your background. Tell us about Life Management Resources.
Okay, well, my background, I've been doing this for, as I tell people, generally longer than most of you have been alive. I've done this for about 45 years. Originally, I was a seminary student in St. Louis and taking courses at St. Louis University as well. Between the two buildings were sort of a skid row, and I used to spend my day walking down there. Of course, I had my dog collar on, and they would sit down and say, Padre, sit down and talk to me. And I would visit with them, and over the years, I visited with hundreds of alcoholics and addicts and just became captivated by their stories and how I might be able somewhere in life to help them. So that became the focus of my studies. When I left St. Louis, came back to Dallas, I got involved in doing more individual and family counseling, but still with an emphasis on those who had some sort of substance use disorder. I did a lot of that work with Charter Hospital. Excuse me. And Charter closed down in 1999, which left Collin County with no outpatient substance abuse treatment programs, and that's where Life Management was born in 1999. Subsequently, we've been able to help about 18,000 people in that area.
That is
really
wonderful,
happy about
Doctor.
it.
In this particular time, I think it's important that we talk a little bit about the practice that you have of telehealth. So let's talk a little bit about that. You've been doing that for quite some time, and talk particularly about why that's important for Texas.
Sure. Yeah. Several years ago, there was an Texas Tech University's medical school, in association with a grant from the medical school, formed a program called the TEXLA Telehealth Resource Center. That's TXLATRC.org. And that program is designed to reach rural areas in Texas, not only with behavioral health, but with physical medicine as well. It's been an amazing program. Texas has 254 counties. 204 of those have either no or underserved mental health counseling programs available. So most people out that area, which is about 3 to 5 million people, have little access, if any. There are 30 counties out there that have no primary physician.
Wait, and say that again, Dr. Hansen. So you're saying there are 30 counties, and again, in the state of Texas, we have 254 counties. We're a huge state,
right.
But 30 counties don't have access at all?
They have no primary physicians out there, and 205 of them don't have access to an adequate level of behavioral health or mental health counseling of any kind. So we have good services in the large cities, but we are dreadfully underserved. We rank 47th out of 50 in being able to reach rural people, and that's what this program is doing, a wonderful job of trying to reach that.
Dr. Stephen Dunn here. Thank you for being on air with us today. As
Thanks.
you know, we're going through such a unique time, not just here in the state, but nationally and globally as well. We have so many folks who have to isolate and self-quarantine. Can you go into a little bit about what impact that has on someone who's struggling with alcohol and drug addiction?
Well, sure. Isolation is probably the number one cause of relapse. I mean, for almost any kind of addiction or compulsive disorder, the last thing that we want people to do is to isolate. And this, of course, has forced that upon all of us. And so for many of those, it's been a huge problem with relapse, as well as people who perhaps didn't have as big a substance abuse problem as they thought they might have, and now that's coming out as a full-blown issue. The lady was talking about Betty Ford had reported a 70% level of relapse currently, which is amazing. I mean, it's just dreadfully sad.
And doctor, if you can back away just from your phone just a little bit, I think we're getting a little baby bit of feedback, and I want everybody to hear this information because what you're talking about is so valuable, especially right now. Alcohol and drug addiction is on the rise, back on the rise. What would be the appropriate way to say? And again, I know there's no way of explaining what we're going through because we've never gone through this before. But both drug and alcohol addiction, or a combination thereof. I mean, when you're talking about an increase in addiction, even more so than before, and then relapses on top of that, what does that look like?
Well, it's a bittersweet thing. The problem is because of isolation, so many more people are sitting around at home. They're isolating. They're bored. They're thinking about issues in their life. They're wondering, what do we have, 16 million unemployed? So this is a huge problem. And so this is, for many people, this is a problem-solving mechanism. That's the downside of it. That's the bad side. The good thing that's coming out of this is telemedicine, telehealth.
Yes, agree.
Our ability... the Medicare, CMS, the Center for Medicaid Studies, has temporarily allowed physicians to be able to do their work over telehealth, and that's been a tremendous boom. And I think that we're all kind of getting used to understanding what telehealth is about. And that is going to be the way that we're going to reach so many people over time. We've been very successful in reaching the rural areas, but I think we'll reach more people this way.
Yes, Doctor, talk a little bit about the process that you use. People are familiar with the program Zoom, but you specifically use Zoom Healthcare. Talk a little bit about how that works.
Sure. Well, there's been some worrisome things about Zoom, and particularly as far as healthcare goes, because some people are just using the regular program. Zoom does have a very special program called Zoom Healthcare that works through a VPN from our facility to Zoom, and it's a 256-bit encrypted program as opposed to the standard 128. So it's a much safer, it's a HIPAA approved program, and that's the one we've been using since day one, and that works very securely.
Doctor, in terms of addiction, and you're in your home, is there really a way to tell just how effective this virtual counseling and telehealth is going to be? Will it ever be really a substitute for face-to-face interaction?
Well, I've always believed it would, Steve. There are some very important things that we have observed now because we have far more people online than we've ever had. And our attendance is almost 100%. I mean, it's so much easier. People work, and at the end of a long day, they've had 8 or 10 hours of driving and working. Then they got to get up and go to some treatment facility and spend 3 hours there, 3 nights a week. Well, that's a brutal schedule. So the ability to go home and relax, get something to eat, and really sit in front of their computer and do this is so much better. A little bit off-putting at first, but we're all used to doing much of this on our screens. In fact, and I wanted to mention this to you, just a little bragging here. We had a patient yesterday that's in our evening program, and he's in Presbyterian Hospital with pneumonia. He didn't test positive for COVID, and he was online. He had him bring his laptop in there, and he was online from his hospital bed last night because he didn't want to miss out on his program. Isn't that amazing?
And that's amazing. So somebody even, you think about it. So if you're in therapy or in some type of a counseling situation, there's plenty of times where you have to cancel or reschedule because you're sick or you have a child or a spouse or a significant other or a family member sick at home that you're taking care of. This
Absolutely.
way you don't have to miss, or if you have a flat tire or you have car trouble or it's something like that. I wonder if maybe more
every day.
And I wonder, doctor, if maybe more people will get engaged in, and this is something that Patty and Steve, and we're so appreciative of Acadia, who sponsors our mental health moment. We're just so grateful because we've been talking about how important it is. Just like you go for a yearly checkup to get your cholesterol checked and all that kind of good stuff. Then this way it allows you those mental health checkup opportunities that you maybe never would have done.
Yeah. Well, we have aftercare program, which is really open for anybody that's ever been in the program, and those folks will come back periodically. Well, at this time now, we're having to open up a special line or a special program just for aftercare people. We've had 40 and 50 people online who came back for aftercare. We never saw anything like that. But this way they can kind of check back in. We can talk with each other. It's just an open question and answer visiting moment. But it's those kind of things have never happened before.
Right.
Because it's so accessible.
Dr. Fred, so what do you envision will telehealth look like in 5 years, let's say? How do you see the technology advancing to make it either more interactive or more effective?
Yeah, well, I think a lot of it's just people getting used to using it, finding out the government and the states figuring out how effective it is. At this moment, we can't cross state boundaries. In other words, we can only visit with people that live in Texas, same way with every other state there is. Those laws were written back in the 50s and certainly did not anticipate telecounseling. I've had almost 300 requests for services from other states. I've had requests from people who live in France and England, Spain. I've had a couple of Russian people, and I'm just telling them I can't help you there. I don't know if they speak English, but the point is it's a way to really do that. And one of the amazing things we've started is we have special programs just for occupationally specific people, for school teachers and nurses. So they can, when they're in a program this way, they're in there with other teachers and they can kind of bat around the same common problems that they have other than just the addiction issues. So there's a wonderful world of telecounseling out there, and I'm just looking forward, hopefully, to seeing all of that occur.
Doctor, we know that about a year ago, our governor signed into law the Texas Child Mental Health Care Consortium Act, and I think that is supposed to establish centers of excellence at 9 universities here in the state, who are then supposed to coordinate and establish telehealth and virtual counseling programs throughout the state. I wonder if you could go into that a little bit.
Well, the one that I am the most familiar with is Texas Tech, and that's because we have worked with them for the last 6 or 8 years, working on the rural area issue, and they're doing that with both behavioral health and physical health, reaching everything from infants to the geriatric community. All of the schools are working on very special programs that can do via telehealth.
Excellent. Well, and hold on, Doctor, because we're going to have you hold you over for the next segment. We will also be discussing, if you want to jump on Facebook Live on JP, Kathy, and the crew, you can join the conversation. We will be continuing this throughout the break, and then we'll finish it up after we finish up being on the air. And again, we just want to thank Acadia so much for being the sponsor of our mental health moment, along with Stephen Dunn's Foundation, the Morgan Foundation, and Patty Giolot's Foundation, Something for Kelly. And Dr. Fred Hansen, we're so happy to have you today. We're discussing addiction, and we'll be right back. If you have a question, please ping us on Facebook Live at JP, Kathy, and the crew, or call us at 214-810-8255. That's 214-810-TALK. We'll be back after these messages with more JP, Kathy, and the crew and our mental health moment here on 1160 AM, KBDT News Talk Sports.
Dr. Fred, while we're on break here, I wonder if we found out yesterday, and we're on Facebook Live right now, that you actually have about a 30-year connection to one of the hosts of the show. Just wonder if you could address that a little bit. It's a very unique story.
Sure. Is he there?
Yes.
Are you talking about JP?
Yeah.
He's not here today. He ended up, unfortunately, he has a migraine. But yeah, we'd love to hear the story anyways.
Absolutely.
This young man, you want to hear it now?
Yes.
Yep.
He came knocking on my door. I guess John was about 18 years old, maybe 19. I think probably 18. He says, I'm running for Justice of the Peace. I knew the Justice of the Peace in Plano, or one of them, and was not real thrilled about him. And he says, I'm running for Justice of the Peace. And I said, really? I said, you're a little young, aren't you? He said, yeah. And he started telling me his story. But he was so honest. He was transparent. His ideas, I thought, wow, this is great. You sure you don't want to be president? And I mean, I was so taken by a young person who had such a motivation to really do something like that. And I said, well, I got to get the word out. Can I get some supplies? And he told me where I could get some supplies. I got some brochures and stuff, and I went around and talked to people I knew. I handed them out at work. I mean, and he got elected. And
I love it.
He's an amazing man.
I love it. Well, I'm going to make sure that JP knows when he's suffering from migraines because of his allergies, and he's also, I don't know if you know this, he's taking care of his dad who's got some very significant health issues. So,
Right.
So anyway, I'm gonna tell him to listen to what you just said. He'll love to hear that.
Well, I just love the man. I've worked with him
too.
As a judge too, with adolescents. So he's a great man.
Excellent. Well, we're so excited. Hey, can you tell us, while we're just on the Facebook Live feed, how to get in touch with you? And then when we come back, Steve, can we make sure that we get him to mention that on air?
Absolutely.
Sure.
I think Patty will take that.
Excellent.
Okay,
Dr. Hansen, while we're on a break, go ahead and mention how people get in touch with you as well.
Okay, it's at lifemanagementresources.com.
Okay.
That's the best way to do it. It's got all the phone numbers, got everything on there. If you're interested in online programming, there's a place at the top to click on our online program, which is onlinerecovery.us. If they just get to that website, lifemanagementresources.com, it tells them everything.
Perfect.
You've got a nice view there.
1 minute.
I love it. Yeah, are you on Facebook? Yeah.
Yeah.
Yeah, it's so nice when it's a beautiful, clear, sunny day like this. We've got a great view up here.
I know. I'm so jealous of those.
And we usually have, and Patty's usually in studio on Tuesday, so it makes it a beautiful view then. No offense, Steve.
I've seen some of that.
Absolutely. And I drag
the
it right
picture I
back
saw
down.
had all of you there.
Oh.
Oh, you have that.
It is definitely a lot more
laugh.
fun being in studio.
It is. I know. We've had to limit like any of our guests that come in, and
Wow.
our regulars. It's been a very different world. So,
Yes.
Yeah.
but we are very
10
grateful and
seconds.
thankful that we can still bring people in via phone. Good morning and welcome back to JP, Kathy, and the crew on 1160 AM, KBDT News Talk Sports. Very excited to have our mental health moment going on right now. Of course, that is we're fortunate to bring that to you because of Acadia Healthcare. Call Chris Getz if you need help. You can reach her at 469-400-7499. Again, Chris Getz at Acadia Healthcare, 469-400-7499. Proud sponsor of the Mental Health Moment here on JP, Kathy, and the crew. Looks like we're headed towards a high of 57, a low of 41, and currently we're at 46 degrees. Welcome back, Steve Dunn of the Morgan Foundation and Patty Gialot of Something for Kelly, and Dr. Fred Hansen, who is our addiction specialist, who is here today to talk about something that is so near and dear, unfortunately, to too many of us. I don't know anybody right now who doesn't know somebody, either in their family or a friend, who is struggling either for the first time with substance abuse or has relapsed as a result of the pandemic, coronavirus that we have going on. So Dr. Hansen, welcome back.
Thank you.
And Doctor, I think at this time of our session, of our program, we always try to do something that gives people hope as well as resources. So what I'd like to ask you to do is to talk a little bit about the programs that you have and what suggestions that you might have to help people live a healthier mental lifestyle. And then at the end, make sure you have time to give them your contact information.
Okay. Well, I get a lot of those questions. People want to know. So I get phone calls. I get people requesting to Zoom with them just to talk to them. And that's basically what I'm up in East Texas at my home up here, and I just have spent most 8 or 9 hours a day just talking to people from all over. And it's just a sense of worry. You know, I mean, anxiety is just a fear of the unknown. We don't know what's going to happen. Our nation has been through things that are much worse than this. We've been through terrible times. We were in good shape before this, and we'll be in good shape after this. But one of the things they can do is stay in contact with their families. Maybe you can't physically be there, but you can be there over the phone. You can Skype with them. There's so many ways to stay in touch with them. I have an active number of classmates of mine from 50 years ago that are on Facebook. And we do these 4, 5, 6 of us at a time. We just get together and visit and talk. And it's actually, I think, in many ways, we're closer than we ever were before. So, you know, it's a matter of reaching out. Don't isolate. Don't spend your time fretting over what's going to happen, because none of us know that exactly. Let's just do what we can in the moment. Let's reach out, talk to people, tell people how much you love them, sit down and write them a letter, just whatever you need to do. But get your mind off of it. Watch something good on TV. Watch HGTV or something.
I recommended earlier today Ozark on Netflix. I'm late to that game, but it's a good show to binge watch.
Yeah, my daughter's binge watching it right now.
Okay, I love it. She and I need to friend each other on Facebook so we can discuss.
Yeah, there you go.
How can people reach out to you, Doctor, when they need to contact you for more information about your programs?
Sure. Well, we're at lifemanagementresources.com. That's a long one, but that's the best we got. We have, because when we started this, there wasn't a web, so we've been with that. It's www.lifemanagementresources.com. We're in Plano as far as where our treatment facility is, but as I said, we're everywhere in Texas, no matter where you are, via our online program. We have another web, which is onlinerecovery.us, and that's on the Life Management Resources page as well, so you can click on that and learn more about the online programming. So pretty easy to get in touch with us. We're there, 12, 14 hours a day, so shouldn't have trouble getting in touch with us.
And you have counselors and therapists there today who will accept calls and reach out to folks. Is that correct, sir?
Absolutely. That some of our people are working from home. They come into the facility to do the group therapy component. State law requires that component has to be done from the facility, and we want to do that anyway. A lot of our
keep on going with that. We've got a few seconds left.
Our individual counseling programs. Most of the counselors are doing that from home. So we're all easy to get in touch with. So just give us a call at 972-985-7565.
Fantastic, Doctor. Thank you so much. And we're going to put all of this information, Steve and Patty, if you'll help jump in and put this information on our Facebook Live feed so everybody can know who they need to reach out to if they need help. Mental health, it seems, is mental health help is more accessible now than ever. And, things happen for a reason. And we just are so appreciative of Steve Dunn of the Morgan Foundation, Patty Giolot of Something for Kelly, and Dr. Fred Hansen. Thank you for being our guest. And again, thank you, Acadia, for being our sponsor. Everyone have a blessed day. And we'll be on Facebook Live a few more minutes longer. Have a good one. Okay, and now we're clear. We're still on Facebook Live. So, Patty and Steve, if y'all have any follow-up thoughts or questions for Dr. Hansen, and then let's talk about our guest next week.
Absolutely. And, of course, we take this segment and pull it apart from the rest of the show, and we put it up. We have a YouTube channel now. You can find us doing a search, the Mental Health Moment on YouTube. Doctor, finally...
What's the name of it? I'm sorry, Steve. What was that? Where was that again?
Yes, it's on YouTube. If you do a search for the Mental Health Moment, we have all of the shows on since September.
Yeah.
And
gosh, wow.
We will have yours up by tomorrow afternoon, and we'll put that out on social media, of course. And, Doc, I think you've covered everything from my perspective extremely well.
Information.
Thank you enough. Patty, how about you?
Oh, excuse me. Yes, I think that you covered quite a bit of subject there, and there's plenty of resources at your website, so I would just direct people to that resource as well.
We appreciate you.
Thank you so much for giving me this opportunity, and I hope that we reach some people. I know we will. And
absolutely.
Maybe we've saved a life today. Isn't that wonderful?
And that would be the best news of all. Save a life, save
Absolutely.
a family. It saves somebody. From what, again, I think it's that you really hit the nail on the head when you were talking about it's the fear of the unknown. Even if somebody is in tip-top mental health shape, which I've been around for a lot of years, and I don't know anybody who's 110% just great in mental health shape. We all have. We all normally have things, whether we want to admit it or not, that we can work on. Yeah. And that's in any given normal day with the normal stressors of life. But you add this and the unknown that we don't know when we're opening back up. We don't know when and how jobs are going to come back and what everything's going to look like. So if you ever thought you needed to reach out and you really feel like you need help, there's so many private ways you can do so. Heck, it sounds like to me, you could take your cell phone with you if you didn't want to tell the rest of your family that you're struggling with mental health. You could take your phone, say, hey, I'm running up to get some gas, and you could sit in a parking lot, which most parking lots are empty right now, unfortunately, because businesses are shut down. You could you could do a teledoc appointment in your car in a parking lot in the privacy of your car right now.
Isn't that wonderful?
That's a real blessing that's come out of this.
It is. It's wonderful.
Yeah, absolutely.
So, well, thank you. And then also, Doctor, you can jump on JP, Kathy, and the crew on Facebook, on our radio show Facebook page. And this we'll be posting this, and then we'll also be posting it on John Edward Payton on his personal page. I would assume y'all are probably friends with him on there. And then also on my page, Kathy Partridge Ward. So we'll have lots of resources. And if anybody wants to share it, or jump in on the feed, if you'd like to put your information, I think Patty and Steve are going to do that as well, your website and your phone number. Just again, the more people we help, the better off we all are.
Absolutely.
Thank you, Kathy.
Well,
you're welcome.
Thank you, Steve. Thank you.
You bet.
I appreciate your help.
They're awesome.
And next week on the Mental Health Moment, we have, hopefully, Dr. Johnny Williamson from the Timberline Knolls in Lamont, just outside of Chicago, and we're going to be talking eating disorders, mental health, and the many co-occurring conditions that arise and how to treat them.
Excellent.
So,
it'll be
have everybody tune in.
It'll be another good mental health moment, which is no surprise. You guys always
There you
produce
go.
a great segment. Well, thank you all. Everybody stay healthy and safe, and God bless y'all, and just keep up the good work. Thank y'all.
Thank you.
Be safe
So
out there,
much,
kids.
Kathy.
All right.
Dr. Fred, thank you, sir.
Thank
again.
you.
Thank you,
Bye, all.
Stephen. I appreciate it so much.
You bet.
Thank you, Doctor.
All right, love y'all. Thank you so much for tuning in today and retuning in on Facebook Live. Please share this the segment with Dr. Hansen and Patty and Steve, and also the segment with Christy. Anybody who we can help from a mental health aspect, that's something that JP and I are very proud of, that we're bringing you on this show. We all need help now and then. I think now more than ever. So now's the time to love on each other and get this information out there to somebody who you might think is struggling. If you don't feel comfortable sharing it on your full Facebook page, then send it through Messenger. Send it privately or in a group, and let people know that, hey, if you know of anybody who needs help, and then send it out that way. Like Dr. Hansen said, if we can even save one life, then wow, how great would that be? We will see y'all tomorrow. We have got Congressman Van Taylor on tomorrow. We also have Michelle May and Brooke Foltz, who are they're both family law attorneys, who are going to be talking about COVID and COVID-19 and custody and what that looks like. And if you are not in agreement with your ex-spouse, what do you do to help your kids? Luckily courts are still open, and they're going to talk to us about that and about TROs and different things of that nature. So anyways, love y'all. See y'all tomorrow. Oh, Randy, good morning. Everybody have a great day, and hopefully I know how to sign off of this and it will post. But we look forward to seeing y'all tomorrow morning. Stay healthy.